Hello everybody, I'm Scott Campbell. Today I want to talk about a few different treatments for dry eyes. We're going to start with what you can do at home. To begin with, you want to stay hydrated, wear big bags of water, drink water. You want to have good lid hygiene. There is bacteria on our skin. Everybody's got it. It's supposed to be there. When it overpopulates around the eyes, it can plug the faucets. It causes inflammation, so the glands don't want to work, and it makes things worse. So you've got to stay clean, stay hydrated. A lot of skincare products can cause issues around the face. A lot of acne medications in particular can cause some issues around the eyes and dryness. Systemic medications can cause dryness. What are you going to do? You have to take the systemic medication, and we deal with the dry eyes afterward. But it all starts at home, and the things you can do is artificial tears. It's temporary at best. Put a drop in, feels good for 5 minutes. Great for situational occasions. Flying in an airplane, flying to Arizona, Nevada, someplace where it's really dry. You get dust in your eye, something like that. Artificial tears really work great. For chronic dry eyes, not a great option. You just have to use it all the time. Warm compresses, they work well. That causes vasodilation, allows the white blood cells to fight the good fight from the inside and fight the bacteria that's on the skin that we talked about earlier. So heat is good. It's a different kind of heat than what we do in the office. Humidifiers can work really well. You can use even desktop humidifiers at workplace. Screen breaks while you're at work. Monitors do weird things to people in their eyes. Everyone's experienced a time when they said, oh, I'm going to check my email, and they blink and like an hour goes by. It just eats time. There's a 20/20 rule that suggests that every 20 minutes you should look beyond 20 feet away. And giving yourself that break also forces you into a more typical blink response. Again, people stare at monitors. They don't blink. They don't want to miss anything. Ingesting omega-3 fatty acids, that can help. That came from a cardiovascular anti-plaquing study that suggested that about half the people that use it had less dry eye symptoms, and it helps prevent strokes, decreases inflammation so that a blood cell doesn't stick to the walls when people stroke. Lid hygiene, we talked about that. Lid massages, limited use. Then we go into prescription medications. There are like 4 drops that you can put in your eyes. One you can shoot up your nose. And some of them are steroids, and some of them are antibiotic derivatives. They are interesting thing about all of those is it takes a couple weeks to see if they work. Half the people won't do it because they sting and they irritate the eye. Especially the one where you shoot it up your nose. It's like snorting pepper or something. It's kind of fun. It's crazy, but it does make you tear. I give it that. But really, people just don't do them because they're expensive. You have to do it twice a day, every day. Really of limited use in my practice. Probably 10% of patients, when they start them, will keep using them. And then we go into the in-office procedures. We have punctal occlusion, which is where you plug the drain so you're keeping the fluid in your eye, provided it's a good quality tear film. And you have to suss out, is the quality there? If not, you have to get the quality good. You don't want to save inflamed cells, or it just irritates the eye more. But if you have good cells, then you want to save them, keep them in your eye. You can use IPL. We do that quite often. That decreases inflammation. Radio frequency, where you put a neural pad on the back. It's a grounding pad, and it draws the heat down to the right level of dermis to stimulate the glands to produce more tear film. That's really been fantastic. And all of these things, they work when all things are right. If you have other skin issues going on, or you're not hydrating, or you're on some systemic medication, there's going to be challenges with all of these. So there is a failure rate to some of these. With radiofrequency and IPL, 92% effective. So that's high. And if you're outside of that, there might be other things to consider. besides just the treatment. Surgery, you can surgically seal the drain shut. You can also, when it gets real extreme, you can decrease the evaporative area of the eye by decreasing the size, by sewing the eyelid shut a little bit. Often patients will be using swim goggles or ski goggles to create a moist chamber around their eyes before that's done. And there can be scarring from your eyelid to your eyeball, which is why you go to such extreme measures. And why we would use amniotic membrane grafts. Stem cell treatment I've found to be of mixed success. Sometimes it's very successful in helping a cornea stay clear for my patients that have a lot of scarring, and others it hasn't. So I don't know. Stem cell research has gone a long way. It needs to go a lot further. So I hope this helps, and thrown out a lot of ideas. Have a good day.